guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about, I am going to butcher this, watch, Canagliflozin. No, I probably got it wrong. I got it wrong. It's called Invokana, okay? I don't know how to say the generic word. A lot of people assume just because we're pharmacists we can say all of these funky names. We really can't. It's let me try it again. Canagliflozin? I'm done. I'm done. We're just going to call it Invokana, okay? Invokana. That's what we're going to talk about today. It is used in treatment of type 2 diabetes mellitus, T2DMM, right? Whatever. Type 2 diabetes. What does it do? So this is really, really fascinating. It depends on what your doctor subscribes to when it comes to his view on how to treat diabetes. A lot of physicians will treat the number. That's one way of treating diabetes. The other way is to treat the disease state itself. So Invokana really leans more to this new style of treating diabetes, which is treating the disease state. It helps your diabetic state by flushing glucose out of your urine. Essentially, you're peeing out sugar is what happens. And here's why that happens. It gets into me explaining the kidney system. It's very, very complicated. I don't want to get into it, but your kidney system, what essentially it does is once your kidney filters all of the fluid out, before you pee it out, there's a long stretch of piping in which it reabsorbs stuff back. So salt, potassium, sugar, there's a good amount of it that for some reason, our body goes, right before you pee it, your body goes, no. We want to hold on to some of that. And then essentially what you're peeing is the stuff that's left over after everything's been reabsorbed. So sugar gets reabsorbed in your body. Even if you have tons of extra sugar sitting in your body, you would think that your body would want to dump it. It does, but instinctively your body reabsorbs some of it, the water and the sugar. So what this medication does is when it gets to that point where you're about to pee it out and then the body wants to take it back, it prevents the body from doing that. And so you pee out everything your kidneys filter. Right? And so that's how, because if you reabsorb glucose back into your body, glucose is sugar. If you reabsorb sugar back into your body, what do you think happens to your blood glucose levels, your sugar levels? It goes up because you're reabsorbing sugar. It's sugar going right back into your body. So that's a no-no. We don't want that. So this flushes it out, prevents your body from reabsorbing it. If it went through the kidneys and, there's no stopping it at that point, it's going to get flushed out. So it's a really, really good medication for that reason. Let's see here. Here are some of the side effects that you want to watch out for. A lot of those really include things like, urinary infections, hypoglycemia, increased thirst, etc., etc. Make sure that your doctor is doing regular blood tests on you because it will increase your serum potassium levels. So if you're someone who eats a ton of bananas, that may be kind of a problem. But, that's in like extreme scenarios. Just make sure you're getting your blood work done. Diabetes is something you want to stay on top of. Doesn't matter if you're on this medication or not. Just always get tested for diabetes. I'm sorry. If you have diabetes, keep getting your blood work done so that you know what's going on because your body could change at any time. Something could poop out on you, okay? Let's see here. Beyond that, if you have renal or hepatic impairment, you want to make sure your doctor knows because then they do have to tweak the medication for you. Let's see here. If you're pregnant or lactating, discuss it with your doctor. This is a relatively new medication. It's only been out a few years. There's still a lot of studies that haven't been done yet. So we just don't know how you're going to react if you're pregnant on this medication. Is it being excreted in breast milk? They don't properly know. They don't know if it does and does not. There just haven't been enough studies done on it. It's just shown so much promise that it's used pretty heavily in practice now, just because it treats the disease state, which is really, really impressive. There is a black box warning. I don't like mentioning it. It's weird. You're going to get really scared if I tell you. It is a black box warning for lower limb amputations. I know. It's freaky. It's freaky. Calm down. I need you to calm down right now. Okay. So what you need to take away from this is that, yes, there were extra documented cases where, diabetes is uncontrolled. They take your leg or they take your arm or whatever because that's where the sugar really does the most damage. But really, the take home here is to monitor for like tenderness, soreness, ulcers in your extremities, infections while you're on this medication. You know, there have been enough instances, but really, you know, it's not to a point where we're going to take this off the market. This is still a very, very good medication. And so it does do a lot of good when you stack it with other diabetic medications. And if you have diabetes, you know that it's not just 1 or 2 meds you're going to take. It's a lot of medications you end up taking because we're treating either the number or the disease state, and it takes a lot of medications to do that. I guess, guys, I think that's it for Invokana. Very, very cool drug, very new, very sort of these new medications that prevent the sugar from getting reabsorbed. They're a really, really great line of medications that come out. I'm very excited as a pharmacist to see how it's going to work in the population. They're all new, so, you know, in 10 years, who knows, something bad could come out about them, and then we'll take them all off the market. That's just how the drug industry goes. But for right now, there's a lot of buzz and excitement about it. So, guys, that's it. If you have any further questions, please direct them to your doctor, your local pharmacist. Otherwise, give us a call here at Telfer Specialty Pharmacy. We'd love to talk to you about it. Please leave us comments below. Let us know how to improve these videos. We're always trying to make them better for you guys. And so if there's something we're leaving out, we want to make sure we put them in the videos then. And that's it, guys. Hope you guys have a good day, and thanks for tuning in. Thanks. Bye-bye.